come in?
Yeah, that's clean.
Hi, Miss Sylvia. I'm your CNA for the day, and I'm going to do mouth care on you, even though you're unconscious. So I'm raising the bed for good working height for me. I'm going to shut the door for privacy. I'm going to keep him covered. I'm going to close the blinds, pull the privacy curtain all the way around the bed, and just for safety's sake, not that she'll be getting out of bed, but I'll step on the brake. I'll take the collet and get it out of the way. So because I have, hand sanitizer, because I have the door shut and I also have the privacy curtain closed. Oh, we just dropped your collet. That's okay. It's another one. You have two. You're lucky. So sometimes we have to uncover them and turn them to their side. So in this case, I'm turning them this way. So I'm going to bend this knee and then have them cross their heart just to get their hands out of the way. Obviously she won't. And then we just turn them to their side and then stick a pillow behind their back, and you can also have the linens kind of help hold them there. And we might combine this with the skill where you turn them to their side so that they're in the middle of the bed, so you have to turn them anyway. So anyway, I'm going to move her back to this side, and I'm going to grab a pillow and put the pillow behind her back.
Is this only when they're unconscious?
This is mouth care for an unconscious person,
Okay.
yes.
Like
or comatose,
if
same
they're
thing.
awake, could you just sit them up?
Yes,
Okay.
but they're not awake. They're not alert at all. They're unconscious. Okay. Don't hit me. So, I'm going to turn the mouth well to one side and place a towel over their chest, like so, and then under Emma's basin, but we don't do that anymore. Now, we just let it all drool out onto the towel. Then a little mouthwash or water or a mixture of, I've heard coconut oil, that they use coconut oils to kind of soften their mouth and their mucous membranes. And then gloves, because we're dealing with mucous membranes. That'll work. Then, whatever works to get those out. Then you dump, or I'm sorry, not dump, you just put it in and get it all saturated, but they can't have too much fluid in their mouth, so you need to control it by squeezing the fluid off of and out of that sponge by just squeezing it against the inside. I've seen students actually do this and like, inside the cup. And a little mouthwash as an antiseptic kind of helps clean the mouth and keep it clean. So then we're going to put it in the mouth, but we're not really going to put it in the mouth. So I'm just going to kind of demonstrate what you would do in their mouth, but I'm not really going to put this in my mouth. So you start on one side, doesn't matter where you start. So I'll start over here, and in a circular motion you clean and move away from the back to the front, and always in a circular motion. And then the chewing surfaces, and then the inside, and then the inside front, the other side, and then it's probably pretty icky. There's a lot of whatever that stuff is in their mouth, and then we would throw it away. That would go in the garbage. And that's what this is here for, because you can throw them in there if you don't have a garbage can close. Now we get a new one. So by the magic of our class, we have a new one. And then the lower, starting on the outside, in the back, working your way around to the front, other side, and then chewing surfaces inside, then around to the front, and then the other side inside and chewing surfaces. Throw it away. Get yourself another one. Then we're going to go into the pockets inside the mouth, and you can use your fingers to open their mouth. And then you clean inside the mouth, and you clean one side. Trust me, when you pull this out, it's nasty. So we can throw it away, get a new one, other side, and you need to get back in the pockets, back in the back, and underneath the tongue, the tongue itself, the roof of the mouth. You cover all the surfaces in the mouth, clean the mouth. And then throw it away when you're all done. We're talking to Mr. Jones the entire time, even though they can't respond. We assume they can still hear us. Okay? All right, Mr. Jones, Mrs. Jones, excuse me. We are all finished. I'm gonna wipe your face. Awesome. We are all finished. I'm going to leave you in that position since it was time to turn you anyway. Give her back her call light. There you go, Mrs. Jones. Yep, you actually put it in their hand or just close by and even clip it nearby. We're all finished, Mr. Jones, Mrs. Jones. So bad they want to call him Mr. I'll see you in about an hour or two and then we'll change your position. So I'm going to clean up my mess and my gloves come off, hand sanitizer, and out we go. That's it. And then you may have to check on them every 15 minutes or so. Then I would, of course, put the bed back down, open up the blinds, all those things that we do normally. And then hand sanitizer at the end. That is mouth care for what?
For the scale, how many do you?
It's for state, you only had to use one to demonstrate, and then you